Progeria syndrome by Amy Schooneman and Sam Zorn. Progeria, or Hutchinson-Gilford syndrome, is a rare, fatal disease that causes rapid aging beginning in childhood. It is an intriguing disease because its symptoms mirror normal human aging, except they are occurring at an abnormally young age. These symptoms can include loss of body hair, wrinkles, and arthritis. The disease is caused by a mutation in the gene that codes the protein providing the body's cells with fundamental strength. Without this strength, cells die early, causing the individual to age prematurely. There is no known cure or preventive strategies for the disorder. Patients are most often treated to help regulate their cardiovascular and other body systems that begin to deteriorate with age. The disorder is very rare and occurs in only 1 per 8 million live births. Causes. Progeria usually occurs due to a mutation in the LMNA gene. This gene codes the lamin A protein, which is responsible for the stabilization of cell nuclei. When the lamin A protein is improperly coded, the nuclei of cells is abnormally weak and dies easily. As cells die, aging is seen on the surface. Because the disease is caused by a mutation, it cannot be inherited or prevented. In an effort to show just how rare the syndrome is, researchers have speculated that usually only one LMNA gene in one sperm or egg of a parent is mutated. Diagnosis. Children with progeria are born normal, healthy babies. The signs of accelerated aging appear between 18 to 24 months after birth. Most commonly, individuals are diagnosed based on their outward appearance of accelerated aging. They may also be diagnosed because of treatment of health problems usually seen in the elderly, like insulin-resistant diabetes and skin changes characteristic of scleroderma, which is when connective tissue below the skin hardens. Sometimes, however, tests will be done to confirm diagnosis. There are 2 tests doctors often conduct. They may do a genetic test on the LMNA gene to confirm a diagnosis. Doctors may also conduct a cardiac stress test to determine if early signs of atherosclerosis are present. Atherosclerosis is the buildup of plaque in blood vessels and a common sign of Progeria syndrome. Signs and symptoms. The symptoms of the disease are almost exactly what elderly individuals develop. However, it has been determined that aging occurs at a rate 8 to 10 times faster than normal. The disease causes friction between the adolescent body's desire to grow and the syndrome's drive to cause aging. Ultimately, the disease overpowers the body's natural tendency. Children with progeria usually stop growing around the age of 3. Other symptoms can include balding, prominent superficial blood vessels, loss of eyebrows and eyelashes, beaked nose, skeletal dysplasia, especially a narrow chest, dental abnormalities, hip dislocation, arthritis, thin and wrinkled skin, and atherosclerosis, which is the buildup of plaque in blood vessels. Treatment. There is presently no cure proven effective in preventing the death of body cells in the disease. Most treatment is aimed at reducing the symptoms of premature aging and giving the patients as normal a life as possible. Cardiovascular disease, which is the most common and serious of symptoms, is often treated with heart bypass surgery. General pain of arthritis is soothed with low-dose aspirin. Growth hormone treatment was attempted to increase the size of patients, but it did not prove effective. There have been proposed treatments. Presently, a type of anti-cancer drug is being tested. Clinical trials on humans using the drug, called FTI lanofarnib, began in May of 2007. So far, no significant ground has been made in these trials. Prognosis. Sadly, because there is no way to slow the aging, progeria is fatal. Most patients do not live past the age of 13. 90% of individuals die due to complications of atherosclerosis, like a stroke or heart attack. Though they do not have a bright outlook, most progeria patients remain upbeat and maintain the playful characteristics of the children they are, but do not look like.